and irreversible cell death that will lead to osteonecrosis. Otherwise, some cases may present with silent ischemia and borderline necrosis. Alcohol is an important risk. In patients with alcohol-related osteonecrosis, the osteogenic differentiation potentials of the bone marrow stem cell are decreased. Steroid can also cause osteonecrosis in many ways. Hennigan found the amount of stem cells in patients taking steroid was decreased. Steroid can also inhibit osteogenesis, increase adipogenesis, causing cell death, inhibit RUNX-Wnt signaling, and affect the OPG-RANK ligand pathway. Animal models in my lab show that fatty marrow conversion has been consistently present at 4 weeks. At 4 weeks, consistently at 4 weeks with fatty marrow conversion. This fatty marrow conversion will lead to increased intraosseous pressure in the bone marrow. When tissue pressure increase, venous pressure increase, arterial pressure decrease, and the blood flow decrease, and the tissue hypoxia happened. This vicious cycle will lead to osteonecrosis. However, not every case is exposed to the same level of risk factor will develop osteonecrosis. Genetic mutations such as single nucleotide polymorphism in factor V, nitric oxide synthase, methylene tetrahydrofolate reductase, and so on, have been found to synergistically cause prolonged ischemia and necrosis. Dr. Kubo in Japan, he reported that multiple drug-resistant gene ABCB1 polymorphism were associated with higher risk in renal transplantation taking steroid. Thrombophilia or hypofibrinolysis have been related to genetic polymorphism of the prothrombin gene, the factor V laden, MTHFR, proximal gene activator inhibitor, protein S, protein C deficiency. Presence of factor V laden mutation was found with 6 times higher risk in Western population. However, factor V laden was not found in most Asian population. We found another locus of factor V mutation associated with high incidence of coagulopathy in our patient. We further analyzed the presence of factor V laden mutation and hyperhomocysteinemia in our patient with osteonecrosis. So mutation of both genes have 9 times higher risk than the control patient. Nitric oxide is a potent vasodilator that can relieve vascular spasm during tissue ischemia. NOS mutation has been reported in Korean, in American patient, and also present in our patient, Taiwan. Using our National Health Registry, we found the risk of a major cerebrovascular or cardiovascular accident was 1.3 times higher, and the risk of venous thrombosis is 2 times higher risk in our patient with osteonecrosis. This data will be published this year. However, the presence of a genetic mutation still cannot explain why some will have bilateral involvement, but others remain silent. We therefore study the epigenetic regulator, microRNA, to find their relationship with osteonecrosis. MicroRNA are small RNA molecules that can bind to messenger RNA and coordinate a broad spectrum of biological processes and the pathological conditions. By fine-tuning the genetic regulatory network. From 2013 to 15, we recruit patients and healthy controls to analyze the microRNA in their peripheral blood. We found the microRNA profile was significantly different between osteonecrosis and healthy control, and we identified 51 differentially regulated microRNA and with at least a twofold change. In summary, the microRNA profile suggests that decreased osteogenesis, increased adipogenesis with these microRNAs, and dysregulated angiogenesis with like a P53, the HIP1 alpha to alpha, and hypofibrinolysis are involved in the pathogenesis. So it is evident from our study that bone marrow stem cells do play a role in the pathogenesis related to hypoxia, tissue cell differentiation, and angiogenesis. So we are interested in the endogenous level of anchoring CD44 in bone marrow stem cells. So we use the bone marrow stem cell and look at the anchoring level in the osteonecrosis stem cells, and we found the anchoring level was a significant decrease compared to the control. Also, with the decreased anchoring level, the NOS nitric oxide signaling was decreased. Also, the nitric oxide expression was decreased. This lower anchoring level or inhibit the anchoring could decrease the cell proliferation and also the anchoring eNOS signaling and the cell migration ability. Also, the angiogenesis potential of the stem cells analyzed by Matrigel show that all parameters of angiogenesis was significantly lower in the osteonecrosis patient as compared with a fracture patient. So it's too complex, but in summary, we thought that tissue injury will release some proteolytic enzyme that will degrade the hyaluronic acid, and this hyaluronic acid will bind to the CD44, and the downstream signaling, including the AKT NOS, in the normal patient is okay. But in osteonecrosis patient, this mechanism, this signal pathway is altered, so that osteogenesis, angiogenesis, cell proliferation, and migration activity of the stem cells are lost. So taking all this evidence together, the pathogenesis of osteonecrosis is still very complex and multifactorial. Genetic mutations, such as the factor V and so on, synergistically affect the patient when they are exposed to the risk factor. Tissue ischemia, tissue hypoxia, and those risk factors will alter the microenvironment in the bone marrow, and which will release the microRNA expression and the reparative process of the stem cells. So in patients who develop osteonecrosis, the proliferation, the differentiation potential of bone marrow stem cells are decreased. And osteogenesis and angiogenesis are repressed. Adipogenesis is increased and the nitric oxide is decreased. So this adipogenesis will lead to bone marrow, fatty marrow conversion, and cause a vicious cycle that increases the intraosseous pressure and the vasospasm that cannot be relieved by nitric oxide and reduce blood flow. If left untreated, finally, the bone marrow necrosis is irreversible, and there will be osteonecrosis come from. So I was inspired by many great men in the study of osteonecrosis. I should thank to my collaborator and the research assistant during the past 25 years. I'm still very fascinated by this disease. And thank you for your attention. And I hope you can visit Taiwan and be my guest in the near future. Thank you.